Hi guys, what's up? This is Dr. Alasa Muhammad. You're welcome to our online clinic. If you're new here, try to subscribe. After subscribing, click on the bell icon so you get updated on drop a new video. Welcome to the clinic. Today we're talking about ovulation, and some persons know about it and some persons don't know, and those that apply the rules they get some get good results, some other persons don't get the result they want. Understand? So the video will be teaching you what you need to know about ovulation, about how to check your ovulation, how your signs of ovulation. Okay, so let's get to the video and please subscribe. Now, what is ovulation? Well, ovulation simply means the release of a matured egg for fertilization. You understand? When the egg is being released for a sperm to fertilize the egg, that means that you're ovulating. You understand? Now, there are some things you should watch out for women. There's some things you should take note of when you're ovulating, because your period of maybe 28 days or 30 days, depending on the kind of period you have. Now, in the middle of your period, there's some things that you might be experiencing that you don't experience them outside the middle of your period. So let's get into them. Now, the first sign is what? Cervical mucus change. Now, we all know that most women, their cervix produces mucus. You understand? While some women don't know about the mucus change in them. Now, I'll be teaching you about the mucus change. Now, as a woman, once you start feeling that you are having like a mucus secreting in you, and you should try to check yourself to know the kind of mucus you are having. Now, to do that, first you should know that the mucus should be what? It should be a clear white mucus. Now, this clear white mucus is produced. It's because your body is producing a lot of estrogen, and that brings about what? The clear white mucus. How can you check this? It's very simple. You lie down, then you put your index finger or put your finger in your vagina, and you try to bring out a mucus. Once you bring out the mucus, you try to what? Put both hands together and what? Bring it out. The mucus should be what? Stretchy. It should be what? Stretchy, clear light mucus, just like the egg white. You understand? So if you are having that, then that's a sign of what? Ovulation. Now I'll go to the second one. The second sign should be what? Heightened sense of smell. Now, some women experiences this heightened sense of smell. They tend to perceive things that most persons don't perceive. You understand? Because their sense is kind of high. You understand? And again, they have this they are being attracted to male. You understand? Because of this high sense, which is called the pheromone androsterone. That is, they get attracted to the pheromone androsterone in men. You understand? So that is one of the signs also. The third sign is what? Breast soreness or tenderness. Now, the breast, so women might experience that their breast is kind of tender, it's kind of soft, and it's kind of more tender, and the nipple might be kind of sore. I say they are having injury, but it's not an injury, it's just sore. They're having like a soreness, there's sore-like structure in their nipple. Understand? That can also be a sign of ovulation. Then the next one should be what? Mild pelvic or lower abdominal pain. Now, this is your abdominal pain. Then this is what? Your pelvic should be below your abdomen. Now, some women, they experience this sharp pain when they are always getting to ovulation. They get this sharp pain, either the left lower part of the abdomen or the right lower part of the abdomen. Now, the pain can last within few seconds, minutes, or hours. Now, when you're having that pain, that is the time your egg is dropping for ovulation. Now, so women experiences such pain, while some don't experience such pain. Understand? So when you're experiencing that pain, that means that you are already ovulating. Your egg is being dropping, and the next thing is to do what? To have sexual intercourse, so your sperm can be introduced to the eggs. Okay, to the egg. Now let's go to the next one. The next sign is what? Light spotting or discharge. Now, the difference between spotting and menstruation. Now, when you are menstruating, you have your normal blood flow. When you are spotting, you're also having like some droplets, and this kind of dropping, most time it is reddish, while other time it is brownish in complete brownish. You understand? Now, if you check yourself and having this kind of spotting, maybe having the brown spotting or the dark red spotting, that might be a sign of ovulation, especially if you're having it in the middle of your period. That can be that can be a sign of ovulation also. Then the next one should be what? Libido change. Now libido changes. Now some women, when they're in the middle of that period, they tend to have this urge for sexual intercourse. Not for all women, but some women experiences this, in which their urge for sexual intercourse is kind of increased. They have this increased urge for sexual intercourse, because when they're ovulating and they have sexual intercourse, there's like a 70% that's going to turn into a pregnancy. So this urge trying to push them, okay, let me have sex to what? To reproduce. That's kind of urge they're having. Then the last one we're looking at today is what? Changes in the cervix. Now the cervix in the women also, it changes. Now some women don't even know what the cervix, what is cervix and where it's located. You understand? Now cervix is located in your female reproductive organ. That is like a ring that hold urethra, like that hold your urethra. That is a womb. Now some women can actually feel your cervix. Now what you do is this: you go to the bathroom, then you can put your leg on the toilet seat, in which you can go to put your fingers in your vagina. So now if you put your hand deep, you can feel your cervix. Now this cervix, when you are ovulating, the cervix is as soft as the lips. You understand? When you're ovulating, it's as soft as the lips, so you can feel it. You understand? And when you are not ovulating, it's as hard as the tip of the nose. You understand? So if you compare your lips and the tip of your nose, it's different, because the lips is more softer. You understand? So when you're ovulating, your cervix is softer. That's another sign of ovulation. If you can check out, we know women are different. So women experience some, while some women don't experience. So, but I know with these 7 signs, there's some women that at least you should experience one of them. And if you're experiencing any of them, if you're experiencing any one of them, then that can be a sign of ovulation. If this video have been helpful, have been good, try to share with your friends and family. Now see you later for our next video, and take care of yourself. Bye bye.